everyone, it's Dr. Tomkowski with Move Free Physical Therapy. Today we're going to be talking about dizziness and what we can do to help it. So, have you ever been dizzy, vertigo, felt like the room was spinning, felt a little bit unsteady when you stood up, things like that? Well, sometimes that is caused by changes to your inner ear, injuries to the brain, or just blood pressure issues. Most of the time, it is not a life-threatening issue. However, before we get into the nitty-gritty of what PT can do to help, we want to rule out some red flags. If you have dizziness that is sudden onset, that does not change when you change positions, that will not calm down, you've got it for hours and hours on end, please call your doctor or go to urgent care. Or if it's really bad, the emergency room is a place you can go. They can get you medications to help bring that down so that you can function a bit. And then we can do more testing to find out what it is. If it's just something that happens when you change position, or you may notice it when you're getting something from the floor, putting something overhead on a shelf. Those may or may not be super scary things, but they're more likely to be something pretty straightforward that we can help with. So, what can PT do for dizziness? So, if your dizziness is caused by a change in blood pressure, so most commonly orthostatic hypotension, or in some people, something called postural orthostatic tachycardia syndrome, which is where your heart rate spikes when you stand up. Those two things are cardiac related, but management techniques like making sure you have enough fluid and electrolytes, wearing compression hose or an abdominal binder can really help with that, as well as strengthening the leg muscles so that the blood that may be pooling in your legs before you get up can get where it needs to get faster. Now, that's not the real reason for this video, but if you're experiencing those things, feel free to reach out and maybe I'll put up a video about that. What I want to talk about today is vestibular rehab. So your vestibular system is the system of canals and nerves within your inner ear that transmit information about where your head is in space, how you're moving, and basically keeps your head upright and keeps you from feeling like you're bouncing or on a boat. So vestibular rehab is a type of physical therapy that's specifically designed to help people who have problems with dizziness and balance issues caused by issues with the inner ear and the other balance organs. Vestibular rehab focuses on exercises and techniques to improve balance and coordination, but mainly to decrease that dizziness and vertigo symptoms. Our goal with this is to improve your quality of life because it's really hard to do things when you feel like the room is spinning. Decrease your risk of falls because, as we know, especially as we get older, falls are often a leading cause of injury. And once again, get back to your day-to-day tasks. Vestibular rehab can be used to treat a wide variety of conditions, such as the most common one, benign paroxysmal positional vertigo, or BPPV. That's most commonly noticed when you're turning in the bed, or you're reaching down to get something off the floor, or you're sitting up quickly in bed, and it happens for about 30 seconds or so, and then it will resolve. That's usually really simple to treat, and within 2 or 3 sessions, you can be back to normal, usually. Other things that may take a little more work are things like vestibular neuritis, labyrinthitis, Meniere's disease, vestibular migraines, issues related to concussions, or age-related changes in the system. So, what types of things do we do with vestibular rehab? Well, it's a combination of exercises and maneuvers such as gaze stabilization exercises, habituation exercises, balance exercises, and in the case of BPPV, we have some maneuvers that we can do to realign some crystals that are in the different canals in your ear to get them back where they belong. These exercises and maneuvers are designed to improve your brain's ability to process the information that your inner ear receives and improve your coordination and balance. You can get vestibular rehab in a clinic setting, either based out of a hospital or a private practice. It can also be provided in the home or virtually. So, if you're having dizziness, it's not an emergency and you need a little bit of help, find a neurofocused physical therapist near you, ideally someone who has some vestibular training. There are some people with certifications that if you have something a little tricky, that may be something to look into. But most neurologic physical therapists can treat most vestibular conditions. So, if you need someone and you're in the state of North Carolina, send me a message and I'll see if I can help you out. I hope you have a great day. Once again, it's Jessica Tomkowski with Move Free Physical Therapy. This is Shelly, and I hope you have a great day. Take care.